My kid, what is going on here?
Oh,
He's been coughing.
Dr. Kim, come over here. This is Daddy just brought in this patient. Apparently, this baby was seen 2 days ago with viral URI, had fever, was sent home, looked well. Mommy and Daddy were saying that the baby has just been breathing very fast, has still been febrile for the last 2 days, and is just not eating or drinking anything.
And they always send us home. He doesn't look well.
I'll take Daddy outside.
Putting the baby on the monitor.
Yes, IVO2 monitor. Put in a set of vitals and a finger stick.
The second IV.
With a rectal temp as well. While we do that, Dad, so does the baby have any medical problems?
Not that I know of.
No surgeries before?
Never.
Allergies?
No, it just
no
doesn't look good though. You're gonna help?
Yes, we're gonna take good care of your kid, okay? What happened just before?
He's just been coughing and won't stop coughing. It doesn't look right. He doesn't look right.
Is he eating okay?
He's eating, but not all. I don't know. I don't know.
Is he urinating normally? Same number of going to the bathroom, same number of times he usually does?
I think so.
Okay.
He's always peeing.
All right. So vitals, baby looks tachypnic. The relative rate of cardiac blood pressure is okay for now.
What am I hearing on the sounds from the mouth? Any striders, breath sounds?
There's no stridor. The airway is patent.
Okay.
The baby is still, talking to you. The child's still talking to you.
And breath
But
sounds?
looks pretty ill. It's pretty tachypnic and pale. The mucous membranes are dry. Has not peed.
Belly exam.
The belly is benign. The cap refill is about 3 seconds, and the lungs are actually clear. There's no murmur.
All right. Let's get a portable chest X-ray. Okay. We'll draw some basic labs as well.
What do you want for labs?
Let's get CBC, comp, and a shock.
Okay. Bloods are sent. Do we know the weight of the baby?
How much does baby weigh?
I have a Brasilo tape.
Okay. And
Baby's 20 kilos.
Can we get a new set of vitals?
Daddy said.
Let's give a 20 cc per kg bolus of IV normal saline.
So 400 ml of NS inside.
And we'll repeat vitals.
Vitals are being repeated.
All right. Justin, can you interpret the chest X-ray for us?
Looks like can't see the airway from here, but things generally look in the midline. Don't see any bony injuries or soft tissue. Lung fields look generally clear. Diaphragms are well defined. Heart border is well defined. Heart size appears to be fairly normal for this portable chest.
And what was the rectal temp?
100.6.
100.6. Let's give 10 mg per kg of ibuprofen.
Okay. 200 milligram of ibuprofen given.
Okay. And repeat vitals. All right. So baby's still relatively bradycardic despite therapy. My concern right now is for sepsis. Source is probably pulmonary. Let's also send some urine as well, and then let's start the kid on vancomycin.
Do you want blood culture too?
Yeah, and send blood cultures too, please.
We have a critical notification.
Shock.
Okay.
We're calling from blood gas. You've got a shot here with a pH of 6.9 and a lactate of 19.
Vancomycin.
Okay. We're gonna give another fluid bolus.
What's your name, doctor?
Dr. Kim, K-I-M as in Mary, first name Eden like the garden.
Thank you, doctor.
Okay. Another 20 cc per kg bolus, and then we're gonna reassess.
Okay, I'm gonna listen to the lung sounds again.
Does
Reassess.
he still have
Second bolus in.
Does he still have delayed cap refill?
Lungs are clear.
Lungs are clear.
There's still delayed cap refill.
Baby's mental status.
Baby has not peed.
Not pee.
Baby is still tachypnic, still opening eyes, mild distress.
Mild distress. Okay.
Looks ill.
Did we get a finger stick?
Oh, let's get a finger stick as well.
Okay. Finger stick. What is it, glucose?
Finger stick is 89.
And did we get the antibiotics in yet?
Yes.
Okay.
Antibiotics is running.
Okay.
Should we get an EKG to evaluate the relative bradycardia?
We're gonna do an echocardiogram, an EKG, And let's just get ready. Let's grab some epinephrine just in case the pressure starts to drop.
This EKG does not show a sinus rhythm. There is poor R-wave progression. There are no P waves in all the leads. It looks like the baby has complete heart block. And there are some ST elevations too.
Do we have any other lab work back? And let's add on a troponin as
Lab
well.
and the echo.
Should we call Pete's cardio?
Yes, we should. Okay, can we also get that bedside echo? Alright, so the echo looks like there's diffuse hypokinesis. My concern now is for a viral myocarditis. Let's start the epinephrine.
Okay.
And we'll talk to Pete's cardiology, but I think the patient will likely need to be transferred for ECMO, given the deterioration. Pressure's now dropping as well.
Epinephrine infusion
Dr. Berkowitz
started.
pointed out the patient is actually getting more tachypnic as well.
Yeah. Let's get ready to intubate.
This patient is 3 years old, so we should use size 3 ET tube and a MAC of 2.
Got it.
Free oxygenating.
We got our suction. Should we call respiratory too?
Yeah, let's call respiratory, set up the vent. I want to get the nearest ECMO center on the phone. I believe that is Columbia.
I can call Columbia.
Yes, let's get Columbia on the phone and get ready for transfer as well.
Do we want to use some sedation?
Yeah, we're going to do 2 mg per kg of ketamine.
So 40 milligram of ketamine.
And how much rock for this kid? 20 kg?
We can give 5 milligram of rock.
All right, 5 milligrams of rock. All right, Mo, you ready?
Rock
Good to
given.
go.
Okay.
Going down the tongue, midline, see epiglottis, and cords.
Need you to listen for breath sounds.
And the tube is in, going to a depth of 15.
All right, do we have color change?
Equal breath sounds. Bilaterally.
All right, for vent settings, I want 10 cc per kg tidal volume. We'll start with a FiO2 of 100%. PEEP will start with 0 and respiratory rate 30. We'll give some versus. Yeah. Can we recycle the vitals as well? And can we get Columbia on the line?
This is the lab, chemistry lab with a panic value. We got a troponin of 37.
Okay, so I am even more assured that this is likely a viral myocarditis with a troponin of 37. Let's bring Columbia. Hey Columbia, we have a 4-year-old patient here that we'd like to transfer over for ECMO. Came in with viral URI symptoms to the ED a few days ago. Came back increasingly tachypnic, decreased PO intake, and urine output. Baby was very tachypnic when she came in. Chest X-ray was clear. We gave a couple boluses of fluid. Had a relative bradycardia in the 90s. Febrile 100.5 rectally. Tachypnic up to 50s at one point. Blood pressure was trending down. We got an EKG, shows complete heart block. The echo also shows diffuse hypokinesis with a poor EF. Fortunately, baby is satting okay, however. We have the baby on an epi-drip. We gave vancomycin as well. We would love to send her over to you for ECMO.
All right, we'll send our team.
Okay.
What is happening to my baby?
Okay,
We're in her vitals right now.
Dad, a lot's been happening. Your baby is very sick, okay?
I knew it.
We're concerned that there's an infection of the heart that's causing... Yes, please take a seat.
You're gonna help?
Yes, we will.
Where are they going?
We're going to send your baby over to Columbia. They have a special machine there that can help with the poor heart function that your baby's got right now, okay? We're giving her some antibiotics.
You want some
Yes, be around. Hug everyone.
It'll be okay.
Thank you. Thank you.